a practical approach to this. And we have presenters, Ms. Millie Reiters, the Chief Director of COIDA Services at the Department of Employment and Labor, Dr. Lucas Mosidi, the Director for Medical Services at the Compensation Fund, and he will be dealing with another topic. There are some resources that have been sent to you directly on the last reminder that is linked to Dr. Mosidi's presentation, additional resources for you to utilize. Then there's Mrs. Michelle Morgan, my colleague in the NIH, who's the Deputy Manager of the National SHE Department for the National Health Laboratory Services, and her colleague also in the SHE Department, Sister Ida Jordan, who's an occupational health nursing practitioner servicing the NICD, our sister institute, the National Institute for Communicable Diseases, that's also supporting the National Department of Health around the COVID-19 difficulties that we're facing. So I need to just say a quick brief apology for Dr. Tanusha Singh, who's the head of our COVID-19 occupational health outbreak response team, as well as the head of the immunology and microbiology section. She had been called by our leadership to another very important obligation, and I will do the introduction. So just a quick check from everybody, if you could just type in your chat box, can you hear the sound as well as the video? A quick number of yeses would be great. Thank you. Thank you. Okay, so it's with great pleasure that I welcome you on behalf of the National Institute for Occupational Health, a specialized division of the National Health Laboratory Services, and we deal with occupational health matters as a public health institute. So we've been conducting a series of webinars since March of 2020, and we've reached almost 30,000 attendees over approximately 40 webinars. And it's with great pleasure that we bring today this particular webinar to you as well on this very important topic. You would have noticed in the series of topics we've covered that the topics are very, very topical, for lack of a repetition there, for at the risk of repeating myself, and in response to the needs that our stakeholders and government liaison people have indicated is critical for the departments, different departments' roles as well. So we are looking therefore at compensation today. This is a very critical question. I think it's on people's minds, and we want to deal with these matters in a way to ensure that you know exactly what are the regulatory and legal framework with regard to this, what is the current developments in terms of the COVID-19 and state of disaster regulations as promulgated, and we have our guest to assist you with that. So it's very critical that you ensure that your feed is a good technical feed so that you can both view the video feed as well as hear the audio stream to yourselves, and type your questions in the Q&A box and make general comments in the chat box. So we've made great strides in doing this training, and I think it's important to tell you that we've made it possible not just to establish a very good Zoom platform with the support of our IT colleagues, information technology colleagues, but also to secure the resources on our website, which is zero-rated by about 7 major service providers, and the names have been on the slides, which I'll show again towards the end of the webinar. We're certainly grateful also for the cooperation with the Department of Employment and Labor, as well as the within the department, the compensation fund, for the relationship we've had over the many webinars we've run, including this one. So I thank you for joining us, and I thank the NIH and NHLS team for their contributions, as well as the IT, communications, and information services sections. I'm now going to quickly introduce you to the topics of the program, and but to first remind you, please, we are only going to require your questions in the Q&A box that's at the bottom of your Zoom screen. It has the double speech bubble, and that's where you ask your questions related to the content of our presenters' presentations and their particular topics. Also, we are going to ask you to please limit your comments only to the chat box. For those people who don't like the chat box comments to pop up in front of the screen, they can double click on the chat icon and it will separate out as a floating box which you can shift to the side, and therefore those little messages won't pop up over the presentation slides of our presenters today. So without much ado, I'm going to ask just to double check on sound if Ms. Reiters, the Chief Director for COIDA Services, is with us.
Yes, Chairperson, I'm with you.
Thank you very much for joining us today, and thank you for making the time to prepare the presentation and share that with our attendees. I'm going to just briefly introduce Ms. Reiters, and I just need to pop up my bio's notes here, one moment. And whilst I do that, Ms. Reiters will just prepare and her slides for sharing with you, and we'll do that in a moment. So our first speaker is Ms. Millie Reiters. She's the Chief Director of COIDA Services. That's the Compensation for Occupational Diseases Act, COIDA Services. Ms. Reiters is trained as an occupational hygienist with subsequent postgraduate qualifications of a Master's of Science in Occupational Hygiene and a Master's in Business Administration. So our speaker is very competent and well qualified and experienced to deal with this particular topic. And the topic that Ms. Reiters is dealing with is the Compensation for Occupational Injuries and Diseases Act, that is Act number 130 of 1993, generally known as the COID Act. So I hand over to you, Ms. Reiters, if you could just share your presentation with us at this point. Much appreciated.
Thank you, Chair. I'm trying to share. The screen is still hanging. I've also sent through the presentation to the organizers, so if they are able to share much quicker than I can, because right now I'm sharing, but my screen is just hanging.
I will make that arrangement quickly in a second with our colleague Glenn in the IT department. Glenn, if you could just open up, that means you must stop sharing at this point in time your particular screen so that Glenn can share his. Thank you very much.
Okay.
Okay, so I'm sure Glenn, there we are. Is that the one?
Yes, thank you, Chair.
Okay, so if you could just indicate to Glenn, you know, move, maybe the word move would be the indicator for him to change the slide for you. Thank you very much for joining us today. Please proceed.
Okay, thank you. As indicated by the Chair, I'm Millie Reiters, and I am the Chief Director for Medical Benefits at the Compensation Fund. So the Compensation Fund derives its mandate from the Constitution of the Republic of South Africa, Section 27, 1C, and then also Section 27.2, which speaks to the fact that all citizens of the country has a right to social security. Then we have our legislative mandate, which we derive the Compensation Fund from Section 15.1 of the Compensation for Occupational Injuries and Diseases Act. And also the Compensation Fund is responsible for compensating occupational injuries and diseases that we have contracted that workers have contracted in the line of their employment. And the Director General is the accounting officer of the Compensation Fund. You can go to the next slide. So what is our mission of the fund? We want to compensate employees for disablement caused for occupational injuries sustained or diseases that they've contracted in the course of their employment. And also we cover the dependents of such if they pass on. Then we also pay reasonable medical expenses that is incurred by our employees. You can go to the next slide. The fund also in the Act makes provision for mutual associations. We have Ren Mutual Assurance Company, which is responsible class 4. That is the mining sector where they deal with the injuries in the mining sector. And then I think as of 2013, we transferred class 13 also to Ren Mutual. This is the iron and steel engineering, garages. That particular class 13 has been transferred to RMA. therefore, people that work in that particular sector are covered by REN Mutual Assurance. Then the fund also has the Federated Employers Mutual, that is FEM, that we have provided also a license to. They are responsible for class 5 injuries and diseases in the building and the construction sector. You can go to the next slide. This is just the compensation cycle for the compensation fund. What is important to note is that the employer is obliged, according to our legislation, to take out insurance from the compensation fund. After they've done so, they need to register and they need to make payment for the assessment. This is all based on different categories and classes, and there's also a risk rating related to this. So the more riskier classes pays a little bit more in a levy to the compensation fund. The fund then issues the employer with a letter of good standing, which then indicates that they are in good standing with the fund, and we then are able to cover the cost for injuries and diseases related to this. Then the employer then need to report accidents as well as diseases to the commissioner. What is important is that the reason why we're saying it, we mostly want to avoid this, is that we would prefer employers to ensure that they have control measures in place and that they have an occupational health and safety management system in place to prevent injuries and diseases. Then we also then cover costs associated if there is an incident that happened or an occupational disease, where we cover medical aid. That is all medical expenses related to the injury or the disease. We also cover for temporary total disablement. That is if you are not able to work for a specific period of time. We also cover permanent disability. That is once you've gotten injured or you have a disease and there's some form of permanent disability that our medical practitioners in the fund then determines what is the percentage disability. We then also pay PD lump sum to our injured employees. We also cover costs for fatal cases. So if an employee passes on based on exposure that caused an occupational disease or an accident, we cover fatal costs. And with the fatal costs, we also cover the dependents. For instance, if it's the wife that's of somebody that passed on, we will then pay a pension out to the spouse, as well as the children until the age of 18. And if the children, there's proof that the children are studying, we then also cover some of the costs in the form of a monthly pension to the dependents. Also with pensions, we have more than 25,000 pensioners as the compensation fund. Those are the people which has a percentage disability of above 31%, where we pay them a monthly pension for life, and it's dependent on the percentage of disability and as well as their earnings. Then, the more you claim as an employer, we then increase your premiums, and if you do not claim, then we can decrease your premiums, and we can also then provide rebates to people that do not claim. You can go to the next slide. So the reporting of accidents, we do have challenges where we would find that employers do not report accidents, they do not report diseases. And we as the fund get a lot of inquiries related to medical services, that medical service providers that are unable now to claim from the fund, because we've, from last year, October, if no liability is accepted for a claim, you cannot submit your invoice to the compensation fund. So we do have a lot of service providers, medical service providers, that is requiring that we pay them but we are unable to pay them if the employer has not registered the claim and we have not accepted liability. So what is important to note, according to our legislation, is that you need to report your incidents within 7 days of it taking place, and then we need to report occupational diseases within 14 working days of diagnosis. You can go to the next slide. Then there are responsibilities also for an employee. Employees need to ensure that they report the accident to the employer immediately. And also they need to furnish all the relevant documentation that is required by the fund for us to be able to register the claim. If we can't register a claim, we can't adjudicate, and also we can't cover your medical expenses. So it's important to make sure that all the relevant documentation that the employer needs is supplied by the employee. Also, the employee needs to submit himself for medical examination and treatment by the doctor of their choice. And also we need to make follow-up on his or her claim from the employer. And then also we are asking organized labor to also ensure that they assist the employee where necessary. I think in the beginning of the year on Checkpoint, there was 2 cases that was in the media of injuries that took place years ago, where those injuries were never reported to the compensation fund. So it's important to make sure that it gets reported immediately. If the employer does not register the claim on behalf of the employee can go to any of our 129 labor centers that we have all over the country and go and present themselves, or they can contact the compensation fund. Then we as the compensation fund will then contact the employer. You can go to the next slide. Next slide, please. Thank you. Then previous slide. The responsibilities of the employer. The employer must register with the compensation fund in terms of Section 80. The employer must keep records of this for 4 years in terms of Section 81. The employer must report your accidents as well as your occupational diseases in terms of Section 39 and 68, respectively within the prescribed period that I've just mentioned. Then accident reporting is an automated process and the employer must register for this functionality. It's important to note that we have our system called CompEasy, and that an employer needs to register as a user of the system before they are able to register claims. Same with the medical service providers. You need to register as a user of our system, and only then will you be able to submit your invoices via an application, and you can also then submit your invoices electronically with service providers that provide that particular service for you to submit invoices electronically. You can go to the next slide. Also, contractors and subcontractors, they also need to make sure that they register with the fund and pay for an assessment. And also failure to comply with the COID Act by a subcontractor will make the mandator or contractor to be responsible for any claims for the subcontractor for the subcontractor's employees. So it is important that if you are having subcontractors, that you need to make sure that they are registered with the compensation fund. You need to make sure that they have health and safety measures in place. Okay. You can go to the next slide. Then management of leave, where the employee may be granted with sick leave, we will, as the fund, pay your temporary total disablement. But if it's unaccepted claims, the fund will not cover the cost related to sick leave, and we have a calculation method that we do. You can go to the next slide. Then the medical provider's role is that our service providers need to examine and treat the employee They also need to give the full clinical description of the injury or the disease by the employees. We have the first medical report that needs to be completed. They also need to make sure that they provide progress medical reports as well as the final medical report, because only once we receive the final medical report can we then make a determination if there is any permanent disability or not. Also, our claims close after 2 years, and if there's further medical aid after 2 years, you need to ensure as the medical provider that you need to apply for a pre-authorization for a reopening of that particular claim. You can go to the next slide. Then the COIDA benefits paid, like I've indicated, we pay for temporary total disablement. That is related to you've been booked off for a specific period of time. We also pay your PD lump sum up to 50%. When it's above from 31% to 100%, we give you a monthly pension. We also give you the widower a pension for life. Children under the age of, until the age of 18, if it's above 18, you need to apply for additional, for us to continue to pay pension to children if they are studying. Then also we cover reasonable expenses. Thank you. Then NIH requested that I also just briefly speak to COVID-19. You can go to the next slide. With the COVID-19, we do have some challenges with employers. They do not register claims. I'll speak to the claims data now. That, for instance, when I do the claims data now, you will see that if we look at Gauteng compared to Western Cape, we don't have sufficient cases. Also, employers are not adhering to the Gazette that we issued on the 23rd of March 2020. And we have delays in adjudication if you do not supply us with the relevant documentation. What is it that we need? We need the employer's report for an occupational disease. This will assist us to register your claim. We need the notice of an occupational disease, WCL 14. We need the exposure and medical questionnaire. We also need the first medical report if and when required, and it must be clear that you need to state the ICD-10 code for COVID-19. You need to also complete the WCL-10, which is a special questionnaire that we've developed, and you need to be able to provide us with any additional information if we require it. And then also we need to have a medical report on the employee's symptoms, history, and then what is very important is that we need the COVID-19, the laboratory results that confirmed that the employee had COVID-19, and if and when needed, we need the progress medical report as well as the final medical report. You can go to the next slide. So this is just our COVID-19 claims. This is as at this morning. Dr. Musidi supplied the information this morning of the updated COVID statistics. So as at this morning, we've received 3,240 COVID claims. The liability accepted, we've accepted liability for just over 2,000 claims. Liability repudiated is for 443. Pending adjudication is 700, so that's about 21%, just over 21% that we still busy adjudicating. And if you look at the gender, it's mostly females, which is 78.2% of the people that contracted COVID, and it was reported to the fund, is mostly females. If you look at our statistics, the Western Cape, we have 1,847 cases, and followed by the Eastern Cape with 666. And if you look at the Gauteng cases that we have received thus far, it's only 398. And for us, that's a little bit worrisome. If you look at our smaller provinces, there's even less claims. You can go to the next slide. Then if you look at the next slide, this is from the mutual associations. No, this current slide, this is from the mutual associations. If you look at Rand Mutual has received 1,539 claims. Liability accepted was for 4 claims. Liability repudiated was for 216. And pending adjudication is 1,319. And if you look at Rand Mutual, it's mostly males that are in the mining industry and also mostly males that are in the iron and steel industry. That's why it's 75.2% is males. You can go to the next slide. This is just statistics that we received from federated employers. They have received 137 claims thus far. And I was just in a meeting, our technical committee for occupational injuries and diseases, which I need to go and attend further when I'm done presenting. And we had Federated Employers Mutual in the meeting, and also with the construction industry, because it was mostly closed during the first portion of the lockdown. That is why we have such few cases for the construction industry. But for them, they have accepted liability for just over 31.4%. And if you look at, it's also mostly males, 86.9%. You can go to the next slide. This is just the benefits that we have paid thus far from the fund. We have paid for medical aid, that is as at yesterday, just over 400,000. This will mostly be for your laboratory tests that medical service providers claim for, or for consultations. This is as at yesterday. Rand Mutual is as at yesterday paid just over 13,000 for temporary total disablement. That is people that is booked off. They've paid a PD lump sum to just over 51,000. And then they've paid funeral costs, which means there was one claim because our funeral benefits is just over 18,000 that we give to our clients for a funeral. I see they've paid just over 18,000 for funeral costs. So I think there was one person that claimed for funeral costs of claims that they've accepted liability for. And then also there's some dependent benefits that they've paid. Federated Employers Mutual have not paid any benefits as yet. You can go to the next slide. What is important is to note that you have to submit your claims.
Okay, it might be that we have a slight glitch there with the video feed from Ms. Reiters. We're going to see if we can try and just reconnect with her. Just to check with our attendees, can you hear and see me?
But I'm in. Thank you. Thank you, Chair.
Yeah, thank you. Please proceed.
My apologies, I've just had load shedding. So it swapped between the Wi-Fi and the 3G. So that is why there was a loss in connectivity.
Yes, I'm glad that the swap happens and you're back with us. Thank you. Please proceed. Thanks.
Thank you. So this is almost my last slide. What is just important is that we have claims for COVID-19 need to be submitted to the compensation fund. We have COVID-19 claims at labour.gov.za. There's also your provincial COVID-19 inboxes that you can send information through. You can get all this information on the website of the Department of Labour, www.labour.gov.za. For Rand Mutual, you can submit your COVID claims to the contact center at randmutual.co.za. For Federated Employers Mutual, you can receive your claims to FEM registry at fem.co.za. Thank you. Next slide.
Thank you very much.
And I think that's it. Thank you, Chairperson. I'm not going to go through, I've taken up more than enough time, and I think I've discussed what is expected from service providers and also the employers and the employees in my previous slides. So it's very similar for COVID-19. Thank you, Chair.
Thank you very much. That was Ms. Millie Reiters, our first speaker, the Chief Director of COIDA Services, that is the Compensation for Occupational Injuries Diseases Act, at the Department of Employment and Labour. Ms. Reiters is trained as an occupational hygienist, and she's got additional postgrad qualifications as a master's in occupational hygiene as well as a master's in business administration. So thank you very much for that contribution. We're now going to move to our second presenter, and that is Dr. Lucas Mosidi. And Dr. Mosidi is currently the Director of Medical Services at the Compensation Fund. And the Compensation Fund is a very important component of the Department of Employment and Labour in terms of social benefits. And it's based at the head office of the Compensation Fund in Pretoria. So Dr. Mosidi is a seasoned occupational medical practitioner with a rich occupational health and medicine experience gained in the mining industry between 2009 and 2016. And prior to that, he worked as a medical officer in the public sector. And so there's both public and private sector experience. And in the public sector, he worked mainly as an obstetrics and anesthesia, for 5 years. After completing his MD, that's a Doctor in Medicina, a degree from the High Institute of Medical Science in Villa Clara, Cuba in 2004. His responsibility at the Compensation Fund is mainly on policy development, research and medical advisory services to both internal and external stakeholders. His role he assumed in June 2017, and he's hoping to use his experience in occupational medicine to benefit the COID beneficiaries, which is critical, especially what we've just heard from Ms. Reiters, that there seemed to be a slow process with regard to work processing claims for the employees. So Dr. Mosidi is passionate about evidence-based medicine, good clinical practice and ethics, as well as patient-centered care. So at this point, Dr. Mosidi, just to check that your sound and video is okay, and if you're ready to share your slides with us.
Thanks very much, Ashraf.
Well, thanks to you for making the time for joining us. We want to consolidate this relationship with you and Ms. Reiters for future webinars. And if you're ready, you can just share your screen.
Okay, thank you. Today I'm not in my best health, but I'm going to try.
Well, we appreciate that you have committed to be here today. Thank you very much. Could you maximize your slides?
Let's see. Taking a little bit of time.
That's fine. The technology is not always as fast as we expect it to be. In the meantime, just a quick reminder to our attendees, please type your questions in the Q&A box. That's the two double speech bubbles at the bottom with the two little figurines. That's where our panelists and our presenters hopefully will be able to assist as well. So I'm going to ask, I know Ms. Reiters had a very important engagement. We're going to ask our other presenters just to look at the Q&A. And please, no general comments in the chat section. I see Dr. Mosidi is ready. I'm heading over to you, sir.
Yeah, good morning. Thanks very much, Ashraf. So the Chief Director has actually laid the path for me just to go straight into what I'm here to present today. So my topic is actually looking at the compensation for workplace-acquired COVID-19 disease and the process of actually going about that. So I'm just going to touch on this fast facts quickly, just to break the ice into my presentation. So we know that the information that we have at this moment with COVID-19 is that it's one of those coronavirus type of viruses that currently it has a incubation period of 5 to 6 days, which can actually range between 0 and 40 days. And the longest has been around 37 days. This is actually 59 years. So what we also know is that 81% of patients will actually remain asymptomatic or will go on to have mild disease and recover with no events. And out of the total population, 14% will develop severe disease, including lower respiratory tract disease. And up to 5% can actually become critically ill with shock and multi-organ failure. And we also understand that the case fatality rate is sitting at 2%, but can also range between 0.2 in those who are under 50, and then up to 14.8% in those who are over 80 years. And old age and pre-existing conditions have actually been cited to increase mortality. So people who actually have pre-existing conditions like diabetes, cancer, HIV, chronic lung disease, and other diseases, they're actually at an increased risk. And lastly, we also understand that currently there's no treatment and there's no vaccine that has been shown to be effective currently, and everything is still under development. So this is a communicable disease. It's actually not an occupational disease, but it can actually be transmitted between employees or from customers to employees while they are performing their work. So when the compensation fund learned of this pandemic, we went ahead and actually looked at the Quiet Act, what we actually need to provide in terms of our mandate as described by the Chief Director. So what we did, I'll go directly to slide number 9. What we did, we actually published a notice on the 23rd of March 2020, which was titled Compensation of Occupational Acquired COVID-19 Disease. And that it was notice CF 03-2020. Then after some deliberations and inputs from our stakeholders, we actually developed a directive, which was later published on the 23rd of July 2020. And then that was then renamed Directive on Compensation of Workplace Acquired COVID-19 Disease. So the reason for the change was to basically say that if we consider only occupations that are at high risk of acquiring COVID-19, we might miss or leave a lot of people behind. So as I've indicated, everyone, regardless of their occupation, can actually contract COVID-19 in the workplace. And therefore, that's why we actually changed the name of the directive to Workplace Acquired COVID-19 Disease. So basically what it does is that it deals with workplace acquired COVID-19, which result from work-related exposures, exposure to suspected or confirmed COVID-19 cases in the workplace, or while traveling on official trip to countries or areas of high risk, on work assignment, or while performing any duty in pursuance of the employer's business. So the main objective was to actually give guidance and clarity on the position of the fund on compensation of this disease when acquired in the workplace. So what we do as the fund, our main task is to actually determine the work-relatedness of the disease, because this as a communicable disease can actually be contracted anywhere. So only when it is contracted in the workplace is then that it becomes compensable. So what we have to do as the fund is that we need to do an assessment of the inherent risk which is posed by various categories of work and occupations, and determine if there's a link that we can actually establish, or exposure to a known source of COVID-19 in the workplace. So we have to determine if there was an identifiable source of exposure in the workplace. Or in the initial stages, we actually also looked at an approved official trip and travel history to countries and or areas of high risk for COVID-19 on work assignment, and determine if that COVID-19 could have actually been contracted. The most important thing that we require is that there must be a reliable diagnosis of COVID-19 as per the WHO guidelines. And then there also need to be a chronological sequence between workplace exposure and the development of symptoms. So we need to see how people actually were exposed before they actually developed the disease. And then what we know is that currently the test that has been approved for this purpose is the PCR test that is done for SARS-CoV-2. And we also indicating that in the case that there's any other test that has been approved by the Department of Labor Fund, we will also accept that as a diagnostic proof. So we currently, I think there has been talks of getting antibody or antigen test that actually can also assist in confirming the diagnosis of COVID-19. So from the legal point of view, for us to be able to accept any claim of an occupational disease or injury, there are three conditions that actually need to be met. The first one is that it must have been acquired out of employment. So it means that the employee must have been involved in tasks for which he or she was contractually employed to perform when the disease was contracted. The second one is that it needs to be acquired in the course of employment. So the disease must have been contracted during the period when the employee was expected to be performing his or her duties or any other duties in the pursuance of the employer's business. And last but not least is that that person who contracts the disease must be a deemed employee in terms of the Quiet Act. So if these three conditions are actually met, then we can then start looking at the claim and look at further merits. So when it comes to diseases in the compensation fund, what we look, we take guidance from Section 65 and Section 66 of the Quiet Act. So what those sections actually say is that if the employee is actually entitled to compensation if he or she contracts a disease listed in Schedule 3 of the Quiet Act. So if that disease is not listed, but it can be proven that it was acquired in the workplace, liability then must be accepted. And then the other thing is that if there's a pre-existing condition that makes it difficult, pre-existing condition must also be approved. And you'll see that in the exposure and medical questionnaire, there's specific questions that actually to determine what pre-existing conditions employees actually have, so that we can know and be able to provide for those as well. And then the other condition that is also included is that when we determine permanent disablement benefit account, and just like any other claim in the compensation fund, if that's made, the benefits will then prescribe. So all claims that have not been submitted.
Dr. Masidi, we've lost your audio there for a moment. Do you think that we should perhaps move your slides from our side? Dr. Masidi, you there? Okay, apologies for that. It seems like we have a slight glitch with the technology. And I'm going to ask my colleague Glenn just to share Dr. Mosidi's slides with us. And in the meantime, we're just going to see if we can reestablish connection with him. It might be, I don't see his name. Okay, he might be back, but I'm going to ask Glenn to, in the meantime, just share the slides with us. So just bear with us. A reminder to everybody, your questions, please, not in the chat box. I've just seen some questions being asked by, is it Emerin and Emerentia, sorry, Stradom and other colleagues, attendees. Moketi Bonje is also asking questions in the chat box. Please shift your questions over to the question and answer section and not in the chat box. In the panelists and presenters are not monitoring questions in the chat box. So please, if you could just do that. In the meantime, we are trying to reestablish connection with Dr. Musidi, and I've asked our colleagues in the IT section just to share the slides. I think Dr. Musidi's connection is not the best at this point in time, but as long as we can get his audio, and he can see the slides move, and then he can speak to that. So just bear with us for the moment. And then just a few quick announcements. The certificate of attendance will be made available to everybody. That is besides people who may require CPD certificates. So Dr. Musidi, are you with us?
Yes, I'm here, Ashraf.
Great. So I'm just waiting for my colleague Glenn just to share your slides with us. And then I think your audio connection will probably be stable enough for us to proceed.
No problem.
Okay, so what was the title of your slides again? I'm just having a look on my side as well.
Compensation for a workplace acquired COVID-19.
Okay, let me just double check if you have sent it on to my colleague Odette, right?
Yes, I did.
Okay, one moment. Okay, it might be that my IT colleagues are just having a difficulty finding your presentation. Okay, in the meantime, do you just want to try and connect again? Because
if I can share.
Yeah, there I can see your slides. If you could maximize it. Yeah, okay. I think we're back online. Thank you, Dr. Musidi.
All right. So what I was saying is that in the directive that we have shared, there's a section that actually talks to how we have categorized occupations in terms of risk. And you'll see that there are different categories there. And that actually assists us when we look at the claims to actually determine the burden of proof or the probability of the work-relatedness of the disease as we receive the claims. So in the slide, I'm just indicating some of those occupations that have been highlighted in the directive. So you'll find that some of the occupations which are at high risk of contracting COVID-19 in the workplace, there are employees who travel frequently on work assignment, transport and tourism staff, pilots, cabin crew, professional drivers, tour guides. You also have front desk employees who deal with customers, those who work in walk-in service desk, retail shops, restaurant, and in some of these workplaces, you actually have a high burden of proof because it will actually be difficult to identify an index case. But as the fund, we do recognize that this type of occupations, are actually some of the occupation where the risk is actually high. And we've also included all categories of healthcare workers, including the mortuary staff, because of their type of work, and especially dealing with people who have been confirmed or who are high suspects of COVID-19. And then you have academic staff, teachers who interact with students and other colleagues as well. And basically all and every employees who are actually exposed to infected colleagues. So in that directive, what we actually say is that all occupations, regardless of the workplace, they're actually covered. So when there's an allegation that someone has contracted COVID-19 in the workplace, then the employer has to submit or to lodge that claim with us, and then the compensation fund will make a determination. So when we look at whether to accept a claim or not, there are certain medical processes that we actually go through, some of which I've actually mentioned. And the first one is causality. And this one, as you can see in the box, they have ticked that in terms of the SARS-CoV-2 causing COVID-19 disease, this one has actually been proven. So there's no conflict with that. So the disease is caused by that virus, and that has been confirmed. And with regards to chronology, we've also indicated that we need to actually see the series of events that actually lead to the contraction of the disease in the workplace. And then the medical probability as well. We have also indicated that there's a specific test that needs to be done to actually diagnose COVID-19 that has been approved by the Department of Health. And that's one of the major things that we actually require when we look at the claims for COVID-19. So this basically will then form part of the first part of the presentation that actually deals with the instruction or the directive that we have published. So from this slide going forward, I'm actually going to be talking about the process of actually lodging a claim with the compensation fund, and especially covering the different scenarios that you'll encounter in the workplace. So we have categorized those scenarios into 4 categories. The first category is that where there's a low risk environment, and then you have a suspected COVID-19 exposure, but the employee still remains asymptomatic. So what happens is that the line manager will have to assess the overall COVID-19 exposure risk. And then if he confirms that the risk is actually low, or then the employee has to continue to work. And then he will then have to monitor that employee's temperature on a daily basis. And then what will then happen is that that suspected case will have to actually be tested, and the line manager or the occupational health service will need to follow up and obtain the index case test result as soon as possible. So if the index case is negative, then there's no further action that is required from the employer, and the employee has to continue to work. But if the case the index case is then positive for COVID-19, but the employee who was actually exposed to that index case was actually using full PPE, that employee can actually continue to work and be monitored on a daily basis for 14 days. And if that employee then starts to develop signs and symptoms, then there are certain steps that need to be taken in line with category 3. And at this point, because the employee has not yet tested positive for COVID-19, there's no need to lodge a claim with the compensation fund. So on category 2, you have a high-risk environment, and there's a confirmed COVID-19 exposure, but the employee who's actually exposed is still asymptomatic. So the line manager has to assess and confirm the COVID-19 exposure risk. And if that risk is actually confirmed to be high, then the head of department will have to approve self-quarantine for that employee. And that employee, because then has now gone into self-quarantine, that employee must be reported to the NICD and the Department of Employment and Labor. And then what happens is that that employee will then need to be self-quarantined at home for a minimum of 7 days with a daily symptom self-monitoring till 14 days since the last COVID-19 exposure. And that employee after 7 days can actually be evaluated for early return to work on day 8. And if he remains asymptomatic, he can then return to work and follow work restrictions as advised. And if possible, COVID-19 symptoms then develop, the employee will then have to follow the route of category 3. And at this point, because the employee is not yet confirmed a COVID-19 positive case, there's also no need to lodge a claim with the compensation fund yet. But remember, this employee would have been reported to the NICD and the Department of Employment and Labor because he's an employee who's on self-quarantine and has been actually exposed to a confirmed case. So this is actually a contact tracing. It complies with the regulations for contact tracing. But because the employee is not yet confirmed a COVID-19 positive case, that employee must not be reported to the compensation fund. Then on category 3, you find that the environment is high risk.
Dr. Masidi, apologies for interrupting you. We do. Can you hear me?
Have a worker.
Dr. Masidi, can you hear me?
So what is that employee has health problem?
Dr. Masidi, your audio is interrupted. I'm going to ask my colleagues in the IT section just to share your slides, and then we can just reconnect with you. Okay, thanks. So is that you, Glenn?
Yes, Ashraf, it's me. So you can proceed from here.
Yes. So Dr. Masidi, your slides are there on the screen. You can proceed, and then your audio would probably be a bit more stable.
Okay, thanks very much. You can hear me now.
Yes, thank you very much. Clear.
Okay. So in terms of category 3, you have a high-risk environment, and here you also have a worker with symptoms compatible with acute respiratory infection. So what needs to happen is that the employer has to assess or to actually refer that employee to a health professional so that his or her symptoms can actually be validated. And then there need to be a determination to indicate whether that employee can be classified as a person under investigation or not. If he does not qualify to be classified as a person under investigation, the employee will then need to follow usual sick leave procedures and then return to work as soon as sick leave has expired. And then if the acute respiratory infection symptoms develop again, that person need to then be referred for COVID-19 testing. And if those tests comes back positive, the employee will then need to follow category 4 steps. And that employee need to be reported to the NICD and the Department of Employment and Labor. And at this point, then that employee will need to be reported to the compensation fund. So the relevant documents must actually be now completed and submitted to the compensation fund for consideration of compensation. You can go to the next slide. So under category 4, you still have a high risk environment, but now you have a worker who has actually tested positive for COVID-19. So the initial step will then be to place that employee on sick leave and to report the case to NICD and the Department of Employment and Labor. Then the third step will then be to have that employee self-isolate and at home if is mildly symptomatic. And then the index case, if it's a fellow employee or a non-COVID-19 confirmed customer, that employee will then be a potential workplace acquired COVID-19 case. So the employer will then need to complete the relevant documents and report the claim to the compensation fund. And then that employee can then return to work 14 days after symptoms if he is actually stable. And this will apply to mild to moderate cases. And then if that employee actually had severe symptoms, he will then have to return to work 14 days after reaching clinical stability. So you can go to the next slide. So when you report COVID-19 claims to the compensation fund, there are documents that need to be actually submitted to us so that we can be able to register and adjudicate on the claim. So most of these documents are actually compulsory because they assist us to actually be able to take objective decisions on the claims. So in this slide, I've actually highlighted those documents, and these documents are actually also outlined in the directive that we have shared. So what I've indicated here is some clinical conditions at testing. So different scenarios that employees will actually present with. So as we have indicated, most people will actually remain asymptomatic or present with mild symptoms, even when they have tested positive. So what the compensation fund will need at this point if the employee is asymptomatic is that you still need to submit the employer's report. And that employer's report obviously will then go with the employee's ID and proof of earnings. The employer need to also submit a notice of occupational disease and claim for compensation, that is WCL 14. And then there's a exposure history, which is a WCL 110, also need to be submitted. So in this form, you'll actually indicate the possible places where the employee could have actually contracted the disease. And in certain cases, you might actually need to submit your roster if you work shift to indicate that this is how the shift has actually been designed, and what are the times when the employee was actually performing work, depending on what the employee does. And there's also an exposure and medical questionnaire that we have also designed, and we have shared as well. So this basically tries to capture the travel history as well as the pre-existing conditions that we need to take note of as the fund, so that if there's a need to actually approve further treatment on those conditions, we can actually do so. And the most important thing is that there need to be a laboratory result. That PCR test need to be submitted, because if the documents are submitted and there's no confirmatory laboratory results, then the claim will be rejected straight away. Now, in terms of the QUED Act, we also need to obtain a first medical report. But during this time, we understand that some of the employees are actually confirmed while they are doing routine screening. And they will find that they have actually not consulted a medical practitioner. And because they are asymptomatic, there's actually no need to consult a doctor. So if that employee was confirmed during a routine screening, then you can submit the rest of the forms and the documents that you have, and then indicate in the notice of occupational disease form or the exposure history that the employee was actually tested during routine screening. But if that employee has consulted a medical practitioner, then we'll then require that the first medical report be provided. And then with regards to progress or final medical report, so if that employee remains asymptomatic throughout the whole period, then we need to have a final medical report submitted to us after 14 days, because then after 14 days, that employee can return to work, and then we need to close that claim. So as the employer, you have the responsibility to actually refer the employee to the medical practitioner, so that the medical practitioner can actually examine the patient and then also fill in the final medical report. So the second category of employees will then be those employees who initially are asymptomatic, but then later develop symptoms. So for these employees as well, we'll need the first 5 documents, which is the employer's report, notice of occupational disease, exposure history, exposure and medical questionnaire, and the confirmatory laboratory result. So at this point, initially, we won't require a first medical report, because that employee will then be asymptomatic. But once he starts developing symptoms and then has consulted a doctor, then you can then later submit the first medical report. And depending on whether those symptoms remain mild or goes on actually to become severe and the employee needs further treatment, then you will need to provide a progress medical report on a monthly basis, and then we need to have a final medical report at the end of 3 months if that employee has actually recovered. But if at the end of 3 months the employee still needs further treatment or is still in hospital, then that employee, we need to continue receiving the progress medical report, and then we will be able to liaise with the employer to actually see what further treatment that employee needs. And then the third category of employees will then be those who have symptoms from onset. And in those, they will obviously need to consult a doctor. So in addition to the 5 documents that we require, we also need a first medical report And then depending also on the symptoms that they have, we will need a progress medical report on a monthly basis. And then the final medical report at the end of 3 months. And the last case will then be fatal cases. We also need all the documents, including a confirmatory laboratory result if it's available, or a post-mortem result where this is also available. And the first medical report, depending on the circumstances, can also be provided if it's available. But what we actually also need is also the final medical report that will actually indicate that the employee has actually succumbed to COVID-19. You can go to the next slide. So what happens when we receive the claim in the compensation fund is that that claim is actually registered on the system, and there's a claim number that is issued. So the issuance of a claim number does not indicate that the claim has been accepted. It's just a reference number that we use then to communicate with the employer and the employee. And once that claim has been registered, we'll then adjudicate on the claim and provide an outcome. So this outcome is actually communicated to the employer, to the medical service provider, as well as to the employee. And then if we have accepted liability, we'll continue communicating with the employer and the medical service provider. And if that employee is receiving treatment, we continue monitoring and evaluating that employee through medical and other reports. And then we provide continuing medical aid. And if that employee then needs treatment or to stay at home beyond 3 days, which is the case with COVID-19, because then there's this 14-day period that is required and compulsory, will then provide temporary total disablement benefit. And then once the employee has actually recovered and has reached maximum medical improvement, we'll then need to obtain a final medical report from the treating doctor. And then from that final medical report, we'll then determine if there's a final permanent disablement award that need to be issued. And then after that, the claim will then be finalized.
Dr. Msidi, are you there? Can we just get a quick indication on the chat if people can hear me? Okay, thank you. We may have lost the connection with Dr. Msidi, his audio. We have his slides online, and we'll just try see if we can get hold of him again. Alternatively, we could move to our next presenter and return to Dr. Msidi. Dr. Msidi, you there? I can hear feedback.
Yeah, I'm really struggling with connection.
Yes. No problem. Proceed. We can hear you again.
Okay. So I was indicating that once we have then received all documents and the final medical report, and we have determined whether we need to issue a permanent disablement award or not, that claim will then be finalized, and the employer will then be required to submit a resumption of duty report, and the claim is then closed. You can go to the next slide. Next slide, please. Tabani?
Tabani, Glenn, could you do the next? Thank you.
Okay. So this will actually basically be my penultimate slide. So the compensation benefits that we provide for COVID-19 disease are the same as any other benefits that we provide under COID Act. So what we do as a fund is that in most of the cases, we do cover all these benefits on a retrospective basis when the case have actually been confirmed and accepted as a workplace acquired. And medical aid will then cover the cost of approved diagnostic tests and clinically appropriate interventions as advised by the Department of Health, the WHO, or the ILO. And for those employees who actually were quarantined in an approved non-hospital facility, we can also then reimburse such costs that they have actually incurred during that time before the claim was actually accepted. So we'll
Okay, I think we have had that audio glitch now with Dr. Masidi. He did indicate that this is his, I think, second last slide. Glenn, could you just move to the next slide? Dr. Masidi, are you with us? Okay. I'm going to ask Dr. Masidi just to sort of reconnect for us. At this point, let's pause on this presentation. We are dealing with the compensation for workplace acquired COVID-19, a practical approach where Ms. Millie Reiters, the Chief Director, started off with setting the background and dealing with some specifics. And on this presentation, we have the very detailed input by Dr. Lucas Masidi on the instructions, that is the instruction on the compensation for occupation acquired novel coronavirus disease under COIDA. The component of the process of claiming for COVID-19, he's also addressed that in some detail with regard to what are the requirements and the specific forms, as well as to the reminder that had been sent out by my colleague. We have the additional links and resources that Dr. Masidi has made available. We will certainly be engaging with Dr. Masidi to look at some of the questions that have come up during the Q&A section so that we could secure his support to assist in answering some of those questions as well. I'm now going to ask if my colleague Michelle Morgan, the Deputy Manager of the National Safety, Health and Environment Department of the National Health Laboratory Services, the NHLS, our mother body, is available and ready to start with her contribution on the employer responsibility around incident reporting and investigation. And as just a brief introduction of my colleague, Michelle Morgan is currently employed as the Deputy Manager for the National SHE Department, that's the Safety, Health and Environment Department of the NHLS, the National Health Laboratory Services. Michelle is based as part of the NIH staff complement. Michelle is qualified biomedical technologist in the field of virology and qualified in environmental health and safety. She has extensive medical laboratory experience and SHE management experience. Michelle is also a SONAS trained internal auditor with years of experience in policy development, implementation, and accreditation. She's affiliated with the numerous committees in South Africa and is an International Federation of Biosafety Associations, IFBA, certified in biorisk management. So another one of our very well qualified presenters. I'm going to just check if Michelle's audio and video link is connected. Or Michelle, are you there?
Yeah, okay. Sorry, Ashraf.
Great, no problem. I can hear you, Michelle. If you could just move closer to your microphone, I see that your slides are on the screen being shared. If you could maximize those for us, and then I will hand over to you.
Okay, I am quite close. I don't know if I'm audible.
That sounds great. Thank you very much.
Okay. All right. Good morning, everyone. As Ashraf has introduced, my name is Michelle Morgan, the Deputy Manager for the NHLS SHE Department. Thank you, everyone, for taking the time to attend this presentation this morning. And my presentation is on the employer's responsibility around incident reporting and investigation. Just taking you back to the source of all the regulations and the acts in terms of workplaces, the Occupational Health and Safety Act 85 of 1993 is an act that came into effect on the 1st of January 1994. The OSH Act has 50 sections and various different regulations. The aim, what is the aim of the OSH Act? The aim is to provide for the health and safety of persons at work, the health and safety of persons in connection with the use of plant and machinery, the protection of persons other than persons at work against hazards to health and safety arising out of or in connection with the activities of persons at work. And finally, to establish an advisory council for occupational health and safety and to provide for matters connected therewith. There are, as I mentioned, there are 50 sections, and these are very comprehensive. These outline the requirements that the employer has to comply with in order to protect employees at a workplace. The sections that I will be focusing on will be sections relating to incident reporting and investigation. So basically, if you start with the general duties of the employers, every employer must maintain a workplace that is safe and without risk to the health of his employees. You notice that throughout the Act, there's the words reasonably practicable are cited. And what this actually means is doing what you reasonably able to do to ensure the health and safety of workers. So the OSH legislation is published by the Department of Employment and Labour, and one of their functions is to regulate the South African labour market through inspections and compliance monitoring and enforcement. Therefore, every workplace is required to comply with this Act. Moving on to Section 14. Section 14 outlines the general duties of employees at work. As I mentioned, it's quite comprehensive, but I have just consolidated it into the most pertinent parts, whereby an employee must take reasonable care for the health and safety of himself and of others who may be affected by his acts or omissions. Thereby, an employee must report any situation in which that is unsafe or unhealthy to the employer or to the health and safety reps. And there are many conditions surrounding this reporting. It must be done before the end of the shift and all of this. So the Act outlines this very clearly. Moving on to health and safety reps. So one of the functions of the employer is to appoint health and safety reps at a workplace. And these reps, the number of reps is also stipulated in the Act. It's one, if you have more than 20 employees, then you need to appoint a rep. So there are various functions of the rep. It's, to inspect the workplace, to review the effectiveness of health and safety measures, to identify hazards, to investigate complaints. But you'll see the one that I highlighted is examine the cause of incidents at the workplace. So whilst a staff will report an incident to the health and safety rep, it is also the function of the health and safety rep to report this incident in writing and also to ensure that this incident gets properly investigated and recorded as well. Moving on to the functions of the Health and Safety Committee. Okay, so they do have various functions like making recommendations to the employer regarding any matter affecting the health and safety of persons at work. But what I've highlighted is that they have to discuss incidents that occur at the workplace, especially incidents where a person is injured seriously, becomes ill, or has died. Um, various companies can have stricter regulations at on-site, whereby every single incident, irrespective of whether it required first aid, whether it was a near miss, whether it required you to go to medical treatment, must be reported. And that is the current situation at the NROH and the NHLS. So moving on to section 24. So the section 24 refers to report to an inspector regarding certain incidents. So as I mentioned, these are incidents that involve where a person dies, becomes unconscious, suffers the loss of a limb or part of the limb, suffers a permanent physical defect, or is likely to be unable to work for at least 14 days. Another incident is when a major incident occurs, such as a major explosion, a spillage, something like that. And then if another one is when the health and safety of a person is endangered, where a dangerous substance is spilled, uncontrolled release of the substance under pressure took place, part of machinery failed, resulting in flying, falling, or uncontrolled moving objects, or machinery ran out of control. So when it comes to section 24, incidents, these are the incidents that we are referring to. And the Act stipulates that these incidents must be reported to the Chief Inspector. Moving on to section 25, reporting to the Chief Inspector regarding an occupational disease. This is where COVID-19 would come into effect. And Dr. Masidi has explained the entire process, what needs to be completed, when, and who must be submitted to. So a medical practitioner who examines or treats the person for the disease will have to notify the Chief Inspector of the Department of Labor and Employment within 14 days. So one of the regulations, as I mentioned, there are various regulations of the OSH Act, and one of them is the General Administrative Regulations 2003. Now, this regulations deals with the employer's responsibility with regard to incident reporting and investigation. Within 7 days of a Section 24 incident, right? So it's these incidents. Within 7 days, the incident occurring, it must be reported to Department of Labor and Employment and Labor in the form of a WCL2. If it's an occupational disease, it must be reported within 14 days in the form of a WCL1. And also I refer you to Dr. Musidi's presentation, which indicated exactly how these must be completed. But coming back to the Section 24 incidents, these, under the General Administrative Regulations, there is an Annexure 1, which is this form. It's made up of this page and this page. So this is where you record the incident and you provide details of the employee, etc. And the second part is where you provide a record of how you investigated it and what were the outcomes. And these only need to be completed in the case of Section 24 incidents. So if I move on to the next slide, the term incidents is defined as an occurrence, condition, or situation arising in the course of work that resulted in or could have resulted in injuries, illnesses, damage to health, or fatalities. So in actual fact, it covers all of that, injuries and diseases. Incident prevention, how can an employer take steps to reduce or prevent injuries at workplace? A risk assessment is a vital procedure that must be done, documented, and then communicated to all staff. It establishes the hazards and risks that exist, and it puts in place control measures that are implemented to control or reduce the likelihood of the risk occurring. And following proper written work procedures and safety precautions, these obviously will fall under administrative regulations, controls, and then wearing the required PPE, like that's your lab coats, your doctor's coats, your protective eyewear, your goggles, your N95 respirators, your surgical masks, your gloves, etc., right? And then there's also the engineering controls that are put in place. So incident reporting and investigation. This is the responsibility of the affected person to report an occupational incident to the health and safety rep and the manager within 24 hours, within the end of the shift, or as soon as reasonably practicable. All incidents must be investigated and recorded within 7 days of the incident occurring. When it comes to incident investigations, what is the purpose? Why do we spend so much time doing this? Well, the immediate goal of an incident investigation is to find out what happened, why it happened, and ultimately to make sure that it never happens again. It may not be possible, but in some cases it will. All incident investigations are both reactive and proactive. Reactive, where you gather facts on what led to the incident, and then proactive, where you make recommendations to ensure that the incident doesn't happen again. Trends are reviewed, gaps are identified, and improvement plans are developed to prevent future occurrences. So just to give you a little bit of background, at the National Health Laboratory System, we have a occupational injury and disease information system, which is called OHASIS. And this is just a screenshot of what our incident reporting module looks like. So as I mentioned, each employee can recommend, or rather outline what his requirements are in terms of what employees should do. So here at the NHLS and the NROH, we recommend that every single incident gets recorded and reported in OASIS, and then every single incident gets investigated as well. So also here we have the incident investigation module, and this includes COVID-19 as well. So yeah, so that's basically it from me in terms of the requirements of the OSH Act regarding incident reporting and investigation. Thank you so much for your time. If there are any questions, please note them and record them on the Q&A section of the Zoom profile, and I would gladly respond to them. Thank you so much.
Thank you very much. That was Michelle Morgan, the Deputy Manager for the National Safety, Health and Environment Department of the NHLS. That's the National SHE Department, for your contributions, Michelle. And as Michelle reminded you, please just add your questions to the Q&A section. That's the double bubble at the bottom, the two figurines, not in the chat section. The certificates of attendance will be made available for everybody, and within 24 to 48 hours, we will send you the link for the CPD test that you need to do for the CPD certificate. Our next presenter is Sister Ida Jordan, who's an occupational health nursing practitioner servicing the NICD. That's our sister institute, National Institute for Communicable Diseases. And she's also part of the National SHE Department of the NHLS. So just briefly, she's an occupational health nurse, as I've mentioned, for almost 20 years, with more than 20 years, almost 20 years experience in occupational health, and worked in various industries from manufacturing to retail, quite a broad experience. Currently employed by the NIH, servicing the National Institute of Communicable Diseases, and she has a qualification in a BTEC of Occupational Health and a BTEC in Safety Management. I welcome you, Ida. Thanks again for joining us. Can you hear me? Are you online?
Hi, Ashraf. Yes, I am. Can you hear me?
Yes, great. Thank you. And if you could share your slides, I see it. And if you could just maximize it, And a quick reminder to people, please, your questions in the Q&A box. I'm handing over to you, Ida. Thanks.
Thank you, Ashraf, and good morning, everybody. Okay, so the most frequently asked question is, how do you prove that an employee contracted this virus at work? Because it's so widespread in the community. So the sad reality is that you will never know for sure, but the decision will be based on probability. Was it possible that it could have been contracted at work? So the same process as Michelle explained, that for incident investigations for your normal accidents incidents should also apply when you do your incident investigations for COVID. So again, the mission is fact finding and not fault finding. And the main purpose, as Michelle also mentioned, is to prevent the recurrence of the same or similar event. And then the reasons obviously is to know and understand what happened, especially when you're doing in the COVID, your close contact tracing, you know, what was the direct contact, what was the high risk contacts with another employee that tested positive, or maybe in your work experience as a high risk worker, what was the exposure to, example, a customer. So you determine the cause, what was the underlying causes, was it failure of controls, is the current controls effective, do you need improvement, and then obviously you do also recommendations like you would do for any other and improve on your current controls. And then also it's a legal requirement based on the OSH Act and also the 2 directives that Dr. Lucas mentioned. So I think when you do your COVID-19 incident investigation, I think it's important to remember what the Compensation Commissioner will consider. So as Dr. Lucas explained, they will consider the exposure, the clinical history, and the inherent occupational exposure. So it depends on, so with your exposure, there needs to be a source of exposure. So if you're like a healthcare worker working with COVID-19 patients, or this source could also be another colleague that tested positive in your workplace. Then also the method of exposure, how was you exposed? And also the duration, are you working every day with these customers, or did you just had lunch for 10 minutes with another colleague, etc. So your clinical history is also important. It would be, when was the last date of contact with the exposure with a positive colleague? The date of onset of your symptoms, the date of your diagnosis, all these should be noted in your incident investigation. And then also, like Dr. Lucas explained broadly, the high risk exposure, occupations that's exposed. So your typical workplace acquired COVID-19 case would look something like this. So you'll have a positive case that is obviously confirmed with a lab test. And then there needs to be reasonable evidence to consider that the infection to be work acquired. So obviously your inherent work exposure is your high risk work, like Dr. Lucas explained, the people that work with patients that's positive, or maybe a lab worker that works with samples. And also retail workers, for example, that's exposed to customers the whole day where you don't know who's positive. And then another one could be a close contact with a colleague who tested positive at work. So in both cases, there needs to be a chronological sequence of events. Let's say a healthcare worker in a hospital looking after COVID people. If you were, example, on leave for the previous 2 days and you start developing symptoms on the day you start your new shift, it would be unlikely that you got it from work. So when you do your investigation, let's say in the inherent work exposure, some methods could be your record, your job description, your timesheets. You need to interview the employee and witnesses, and also you can do a workplace inspection. So obviously your job description will determine whether it's a high risk work. So you also, for your own purposes, see if the control measures were implemented and maintained. If there was, you know, were they maybe not wearing was customers allowed in the retail shop without masks, for example, or is there procedures in the hospital where you need to, the donning and doffing, taking off your PPE. So maybe there's a procedure where staff will take off their gloves and their masks, but, you know, go to the tea room with their lab coats. So you need to investigate all the the SOPs, are they following it? Is there maybe a need to improve to prevent another recurrence of infection? Is there sufficient PPE? And then was there also a specific incident that the employee can relate to where, example, a customer wasn't wearing a mask, or there wasn't enough PPE available in the hospital at that stage? That could be a definite, also a sign of exposure at the workplace. So for close contacts with colleagues, you can also use your records of attendance, registers, and remember we're doing daily screenings. So to determine your onset of symptoms, you can use your history of your daily screenings. If you've got an on-site clinic, you can even get information. Just be careful of or mindful of confidential information. If you work in manufacturing plants, maybe in small areas with lots of machinery, you've done a ventilation survey, you can use all those information to determine the risk of contracting the virus at the workplace. So also you need to interview the employee, the positive employee. What was the date of the onset of the symptoms? What was the date that he tested? What was the last contact with another positive employee? And then also the workplace inspections, you can see your control measures. Is there physical barriers maybe, or maybe you had administrative controls where people were working different shifts, half of the staff, but on a certain day there was double production and you had to call in all your staff, and then the exposure risk was higher. And that's all you can note on your incident investigation. So just for the chronological sequence of events, so this is what we know about COVID, is that you could be infectious for 2 days before the symptom onset, but usually most infections when your symptoms start, and your infectiousness will last for the first 7 days. The incubation period from the day when you were exposed until you start showing symptoms could be 2 to 7 days, but most commonly 5 days. So if you keep all this facts in mind, so this is how a possible work exposure could look like. So let's say employee number 2 tested positive on the 10th of, let's say, August. It was on a Sunday, and he claims that he got infected through his colleague that also tested positive. So in your incident investigation, you would determine the close contact. So let's say both employees were at work on the Monday, and there was through history taking, determined that there was close contact between them. They either, for example, went into the supervisor's office, which was small, no ventilation, nobody was wearing masks, and they were discussing, I don't know, the soccer from last year for 10 minutes. And then, so the first employee got symptomatic on the Tuesday, and he tested. He went home, went to a doctor, and then he tested positive on the Thursday. He went into isolation. Your second employee started having symptoms on the Saturday, went to his doctor, and he tested positive on the Sunday. So knowing that there was a close contact, and knowing that this person is symptomatic or infectious on the day that his symptoms starts or before, for 7 days, given the fact that this person was in contact with case number 1 on the day before his symptoms start. So it's very possible that this was his incubation period, and then he only started developing symptoms on the Saturday. So that is a very probable scenario to have contracted it from your colleague that tested positive. So just in conclusion, I think we must just remember that when an employee alleged that he got a disease or at work, an accident, you have to report it to the compensation commissioner. It's up to the commissioner to decide whether they want to accept the claim or not. So as long as you do your incident investigation and you've got all your facts and you can submit additional information, it will just help the compensation commissioner to make their decision as well. But when in doubt, rather submit it. And then remember, it's a no-fault compensation for employees. So they're not looking for facts of why were you not wearing your mask and why were you're having tea with your colleague that tested positive, so they will compensate based on the facts if it was possible to get it from the workplace. And also remember, your incident investigation should not only be done for the purpose of reporting it to the compensation fund. It has to follow the process, like Michelle explained, from determining the root cause to implementing and evaluating the corrective actions, how to prevent, how to improve your corrective, your control measures. And then just also a caution. So when you discuss incidents, in example, your safety meetings, or if you give monthly reports to management, just be mindful of the confidentiality as well. With when is it necessary to submit a name? So it would be maybe when you do close contact tracing or discussing it to improve interventions, but don't mention, example, personal information like comorbidities or the symptoms that the person developed. So that is not important for the sake of for reporting for your management or in the safety committee. And then the last conclusion, I know they asked me just to touch again on the reporting structures, because a lot of people send questions on when to report and when and how. So there's two directives from Department of Labour. So the one is on the Occupational Health and Safety COVID-19 directive, and the second one is the directive for workplace acquired COVID-19. So for the HRS directive, they mentioned that you need to report all positive cases to the Department of Labour, but the intention definitely was, if it's work-acquired COVID-19, you need to report this, and this refers to that Section 24 and Section 25 of the OSH Act. So you need to report it to the Chief Inspector of your area from the Department of Department of Labour, and you'd send an email to your inspector using the WCL form. So where you get your inspector's information, you need to find your Department of Labour's office in your region. It's not freely available on the intranet, so internet of the website of the Department of Labour. So you need to phone them to get the correct contact details for your inspector, and you can use the WCL form 1 to send that. For COVID, we had a long discussion this morning, so I don't think I need to add anything to that. But it's definitely two separate reporting structures. One is for the Department of Labour, and one is for the Compensation Commissioner. So that's it. Thank you very much.
Thank you very much. That was Sister Ida Jordan, who is dealt for us. Let me just get that program up again. Apologies. Who's dealt for us with the basic approach to investigating COVID-specific incidents in the workplace, and we are thankful for her contribution there on that particular part. And you can see the logic in the sequence of topics that we've dealt with, from the contribution of Ms. Reiters, the Chief Director of COIDA Services, Dr. Mosidi, the Director of Medical Services at Compensation Fund, our colleagues, Michelle Morgan, the Deputy Manager of the SHE Department, the NHLS, and her colleague, Sister Ida Jordan, in providing with very valuable information and tools. There is also the questions you've asked in the Q&A, and at this point in time, my understanding is that we are going to ask Dr. Mosidi if he could just join us again. I understand that we have been connected with you, Dr. Mosidi, for some summary remarks on your particular presentation, as well as you've heard. You might want to make links to the presentation of the other co-presenters, and if you've had a chance to look at the Q&A box, if there's any specific key questions that have arisen there as big themes that you want to address. Dr. Mosidi, are you with us?
Yes, I'm here. Ashraf?
Yes, thanks. Please proceed. Thanks for rejoining us. Much appreciated.
Yeah, thanks very much. So what I would like to indicate is that in the latest directive that we have published, there are provincial email addresses that employers need to actually use to submit their claims to the specific provinces in which they are based. And there are also contact numbers of the provincial offices of the Department of Labor that deal specifically with compensation fund issues. That's the first thing. The second thing is that I see a couple of attendees have actually asked around the exempted employers. So if you look at the Quiet Act, we actually have three type of, I would say, employers or compensation system which fall under the Quiet Act. So the first one is the compensation fund, where most of the employers will submit claims to directly, and then and those specifically in the private sector. The second one is what the Act calls employer individually liable. So most of those employers, the public sector, hospitals, military, certain categories of military and certain categories of SAPS and municipalities. And then the last ones, they're actually the mutual assurances, which deals with construction and mining and steel. So when it comes to exempted employers or employers individually liable, employees in those environments actually need to submit the claims to the employer. Usually it's through the HR. You'll find that they have a section that deals with occupational diseases and injuries. And there's a process that actually will then unfold once the employer has gotten the documents. There's a process where they actually interact with the compensation fund. And then the duty of the compensation fund is to determine liability. So once liability has been determined, whether a claim is accepted or not, then there's that decision is actually referred back to the employer to say that, okay, this claim is accepted, you can then proceed with the rest of the things. So what happens is that then that employer will then take over the payment of all the benefits that are actually due. And those employers, they actually know how to provide those benefits. So when an employee is admitted to hospital, they will be able to cover the medical costs. When there's a TTD to be paid, they know how to pay that. When there's a fatal benefits and all those benefits, they know how to do that. But the process of adjudication is the same. It's done by the compensation fund, and then the decision that is made by the compensation fund becomes final, and the employer just has to implement. So I will end there. I think those are the two issues that I wanted to indicate.
Thank you very much for that, Dr. Musidi, and thank you for joining us again, and the colleagues in the IT department for helping on that. I know that Ms. Millie Reiters is not available at this point in time, but if I could ask maybe from Michelle, are there any sort of final roundup commenting to make a summary statement on the importance of the incident investigation components that you've dealt with, Michelle?
Okay, yes, Ashraf, as I mentioned, it's the investigation part is very critical. And the reason being that you've got to actually find out the W's, when, why, who, what, all of it, so that measures can be put in place so that the incident does not recur. And as I mentioned, it's not possible to prevent certain incidents. However, the control measures can drastically reduce incidents from occurring in the future. So it's quite valuable in that term. Yeah. And as mentioned, it's also a legal requirement. And in terms of employee safety, in terms of cost as well. So it benefits the company, the employer in the long run.
Thank you, Michelle. Thank you for that. A quick comment from your side as well, Ida. I've got a specific question to put to Dr. Masidi once we're done. Ida?
Hi, Ashraf, not really. Sayana, I've got, yeah, you can have the
No
line.
problem. Let me ask that question. We got about 4 minutes left. Dr. Masidi, there's a question here from Lucina Wabisa. And Lucina is asking, we are trying to get registered onto the CompEasy system so we can register the claims. How can we get assistance in this regard, as we've been trying to phone? So in essence, I think Lucina is asking how best to connect in order to address this. Would that be through your section, the compensation section, or would it be through the section that Ms. Reiters is involved in?
Yeah, there's actually a section that is called Employer Services. So the registration is actually done through that section. But what needs to happen is that all external users need to register first on the Department of Employment and Labor website as external users. So once they are registered there and approved, they can then proceed to register on CompEasy. Then the process there becomes a little bit easier. So if you try to go directly to CompEasy, then it's going to give you challenges.
Thank you for that, Dr. Masidi. My sense is it's also probably got contact and email for any queries that people might have in doing those registration processes on the website as well. Is it perhaps included in the additional resources that you had indicated is available? My understanding is that Dr. Ded Valmink has made arrangements for those additional links and resources to be circulated, and it will be available on the NIH website. I need to remind our attendees as well. So would those numbers be included in those additional referral contacts you've provided?
Yeah, in the document, we have provided the contact numbers for the provincial offices that can be contacted for assistance with regards to registering on the system. And there's also a national call center number that we've also provided there. So you can also peruse that, and then you'll get the assistance accordingly. Otherwise, you can go directly to the Department of Employment and Labor website, and then there's also information that is actually posted there on how to go about the process.
Thank you very much, Dr. Masidi. That's brought us to within a minute of the closure of our webinar. And at this point in time, I need to say so much thanks to you. That is Dr. Lucas Mosidi, Director Medical Services for the Compensation Fund within the Department of Employment and Labor. Dr. Mosidi has dealt with instructions on compensation for occupation-acquired novel coronavirus disease under COIDA, as well as the process of claiming for COVID-19 workplace-acquired exposure under the COIDA. Dr. Mosidi, thank you very much for your contributions. And I'm hoping that we could perhaps get your support in just looking across some of the questions that people may have asked in our Q&A section. Would that be possible?
Yeah, actually, I've been looking at the questions. I've tried to answer as much as possible. So I'll stick around. And
thank you very much. Yeah.
Right.
And I'll ask Dr. Ded Valmink just to liaise with you as well with regard to that. Thanks for Dr. Masidi. And then in her absence, a big thanks to Ms. Millie Reiters. I might ask Dr. Masidi also just to convey our thanks to her. And she's the Chief Director for COIDA Services, that's Compensation for Occupational Diseases Act, in the Department of Employment and Labor, and she's dealt with the compensation for occupational diseases as the COIDA Act itself, number 130, and its provisions and specific instructions that's linked to that. And then again, to my two colleagues, that's Mrs. Michelle Morgan, Deputy Manager of the National SHE Department of the NHLS, just on the campus here next to us in Braamfontein. Thank you. She's dealt with the employer's responsibility around incident reporting and investigation. Thank you, Michelle.
Pleasure, Ashraf.
And then, thanks, yes. And then also to your colleague, yes, Sister Ida Jordan, the Occupational Health Nursing Practitioner servicing the NICD, National Institute for Communicable Diseases, is our sister institute within the NHLS. She's also part of the National SHE department of the NHLS based at the NICD, and she dealt with a basic approach to investigating COVID-specific incidents in the workplace. Thank you very much to you, Sister Jordan. Thanks, Ida.
Thank you. Thanks, pleasure.
Okay. Yeah. And then finally, a big thanks to the team. We don't see them. It's the IT colleagues and the IT colleagues that is making sure that we get all of our connections and so on sorted. And it's not always easy because we are dependent on an external Zoom provider as well as the internet and other sort of service providers that get us connected on bandwidth and so on. So I need to then say thanks to that is Tabani and Glenn in the IT section, who's been doing amazing running up and down the staircases as well in our building in connecting with people to get them connected. And then our list of panelists, that is Karen Dupree from the Immunology and Microbiology section. Thank you very much. And also for standing in for Dr. Singh today. And then Anna Fourie, hold on, I've got that wrong. Karen Dupree is in the Occupational Hygiene section. It's Anna Fourie I need to thank for standing in also for Dr. Tanusha Singh today. Anna, thank you very much. She's in the Immunology and Microbiology section. Also a colleague of Karen in the Occupational Hygiene section. And then the colleagues from Occupational Medicine, that's Molan Mogambo, Dr. Molan Mogambo, Dr. Nompumulelo Mpumi Ndaba, Dr. Oded Volming, and Dr. Samantha Yalu. Thank you very much for your contributions to answering the questions in our Q&A section. And then finally, a reminder to all of you, please visit the NIH's website. You'll find the links even to the additional resources Dr. Msidi has made available on the website. It will be uploaded within the next 12 to 24 hours. And we will also send you the link by email to all the presentations that will be uploaded on our website. The NIH website, that is www.nioh.ac.za, is an important resource for you in dealing with COVID-19 within the workplace. We have a Twitter handle you'll see advertised as well in our emails, as well as the NIH email address, that's info@nioh.ac.za, and we have a Twitter handle for you to follow as well, which is quite critical. And at this point in time, I need to say thank you very much for joining us today for this compensation for workplace-acquired COVID-19, a practical approach. I hand over to Glenn. Thank you. Goodbye.
Thank you.